primary promise: building the nation's model health system for children. We're building a new hospital, and we're excited to bring the power of primary children's to Utah County and beyond. The Larry H. and Gail Miller Family Campus will bring the services of primary children's to the fastest growing area of Utah, bringing care closer to home for so many families. Why a second primary children's hospital campus? For years, Utah has been home to one of the nation's highest birth rates. This population growth, combined with our multi-state service area, means that more than half of our primary children's patients must travel over an hour to reach us.
On the day she was injured, it was August 1st, 2016. She was at her grandmother's house. My mother-in-law called me, just hysterical. Something about her leg and something that there was a big accident. She was on the riding lawnmower with her grandmother, so she jumped off to get her sandal. It pulled her under and ran her over. She was missing her right leg.
She was born and everything was great, happy, healthy baby, and I just kept having a feeling that something was wrong. So finally they took her into the little nursery and they hooked her up to the monitors and saw that she was having a very hard time with her oxygen. She was having a hard time breathing.
When I was pregnant with Talmadge, he was diagnosed in utero with a heart defect called hypoplastic left heart. And that means that Talmadge does not have a left ventricle. I went into overdrive, just gathering all the information, researching. And as we studied it out, we made a really intentional, mindful decision. We were very confident with Primary Children's Hospital and the care our son would receive there.
When we first brought Brielle home, she still had so many needs. She has something called, say, Barber-Biesecker Young-Simpson syndrome. We had probably 3 to 4 appointments every week that we would drive to Salt Lake for. And it took the whole day to drive there, have the appointment, and come back. And so having that new facility there in Lehi is going to be amazing for people to be able to have access to those appointments, just the care that they'll be able to receive.
The exciting thing is that we're bringing care closer to home. So the nationally recognized excellent care that is delivered at Salt Lake City Primary Children's Hospital will also be delivered here at the Lehi Miller Family Campus. Not only do we serve Utah County, but we'll be serving South Salt Lake County. We'll have all the pediatric subspecialties that you can be seen at the Salt Lake campus or even our Wasatch Behavioral Health campus. All those will be located here.
You just know that you're being taken care of by some of the very best doctors and nurses that are out there. At the time, she was only one of 19 diagnosed ever in medical history. We use so many different specialists up at Primary Children's Hospital to help take care of our girl.
We're setting the bar for what's possible in children's health, here and across the nation. Building a model health system that meets the needs of children today and the generations to come.
We will be prepared to be a Level 2 trauma center, the only pediatric trauma center here in Utah County.
Where my grandma lived, it was in American Fork, so we had to go all the way to Salt Lake.
When we were driving up, it had to be the longest drive of all time. Get the whole family, get in the car and go while she's in the helicopters.
My husband had to drive, 45 minutes up there to the hospital just to come see her. So just having it in your backyard is gonna be awesome.
And so to be able to get those kids in faster, to be able to see pediatric trauma specialists and have that trauma care delivered immediately rather than having to be transferred again to another facility is exactly the need we're trying to meet.
When I think of Primary Children's, it makes me feel happy. Primary Children's will make sure that you'll have hope. They'll make sure that you will recover and you'll have the best life after.
Our goal is to bring that same care to the Miller campus. And we're doing that by having the same medical staff that goes between the two facilities. We have many caregivers that will go between the two facilities and also the same governing board. We've been very intentional about the design so that the look and feel inside this campus is similar to our Salt Lake campus. So we want it to be a primary children's experience, whether it's in Lehi or Salt Lake.
My name is Talmadge. I'm 4 years old. When I grow up, I want to be a pilot.
Not one day of Talmadge's life is promised to us, and I think we feel that. Once Talmadge was born, we just hit the ground running with that boy, and we haven't stopped. We love to get out and play together. We love to boat. We love to play in the backyard. It'll bless our lives to be able to just zip over there, get the care that he needs, less time away from the family, less time away from playing for him.
We're very grateful. We're grateful for the care it gives, but we're also grateful that we live close.
We're building this hospital campus to meet the needs of today with the forethought to grow with our community. That's why philanthropic support is vital. Together, we're working to ensure that top quality pediatric health care will be more accessible to families across the Intermountain West.
And we know that we'll have more kids down here by the year 2038 than we will in Salt Lake. And so really our funding priorities are all about how do we extend that world-class care even further.
As leaders and as frontline caregivers, we're excited to be able to announce that we'll be opening in early 2024.
So there's like a sense of pride with that hospital. Like, I'm proud to have my son be a patient there because they do take such excellent care of him. And he feels that too. And I think that's a cool thing that they've been able to provide or accomplish, that he can feel proud and be happy with that association to the hospital. When we live really close to the new hospital that's being built, and when we drive by it, Talmadge says, "There's my hospital."